The role for telehealth in orthopedics is rapidly expanding. However, barriers to effective patient evaluation exist, and a successful patient assessment is highly technique dependent. In particular, performing a shoulder physical examination during a virtual encounter poses many obstacles. The patient and provider must carefully coordinate a routine while also capturing the necessary angles to record a so-called selfie exam. This process can be tedious and frustrating, often requiring repositioning of the video device or another person to assist with filming. The provider must instruct the patient in these movements, ensure that the recording is adequate, and take measurements to assess range of motion and shoulder function. We present a technique to complete a comprehensive shoulder physical exam using an easy-to-understand pictorial guide called the Shoulder Telehealth Assessment Tool. Parameters include assessments of all planes of shoulder range of motion, VAS, and SANE scores. All components necessary are included to allow for conversion to an abbreviated constant shoulder score if the provider so desires. The form is distributed to the patient electronically or through regular mail prior to their scheduled e-visit. Although this can be performed by clinic staff, this added step is a limitation of our described technique. The form is designed to be completed by the patient at home prior to the encounter without the real-time instruction of a provider. Patients are instructed through simple movements compiled in the pictorial guide. These movements have been previously studied in the physical therapy literature to correspond to minimum shoulder ranges of motion. The form allows the patient to accurately track their responses as they go through the exam. Any questions the patient has regarding the prescribed maneuvers can be addressed during the encounter. Although video conferencing is certainly helpful, the physical exam form presented here can be effective even if the telehealth encounter is limited to a simple telephone call. We aimed to eliminate the need for video chat altogether as a means to simplify the telehealth encounter. Initial intake can be performed by non-provider clinic staff to increase the encounter efficiency. The patient responses from the form can be easily transcribed into the electronic medical record by the provider, making for a more smooth documentation process.